Hello there. My name is Dr. Diamond. I'm going to be doing your consult today. Now, not to be jump off the bat kind of like, oh, rude, but I was gonna say, what brings you in? However, I'm gonna go ahead and take a guess, just observing that you might want to do some stuff to this region. Okay. Yes, it looks like you're probably due for something. So, it's okay. Sometimes we just get a little bit ugly, just a little. And we have people like me who just restores, and brings back, that pizzazz when you look at someone. Whether it be good or bad, you want to stand out. You don't want to be average. You don't want to look like you're aging like the rest. You want to stand out. Whether that be good or bad, stand out as in, wow, they got some work done, but you can barely tell who's the doctor. Or you want to say, yeah, you really stand out. That's very different. So either, one or the other. Maybe you want to have the biggest lips in the world, the biggest chest in the world, whatever. So whether it's good or bad, a lot of people just want to stand out. So what do you want to stand out for? Perhaps your nose? Should we give you something like next level different? Your nose is a little bit flatter, more round. I think we should, just bring it to a point. Yeah, cute little button nose. But if we do that, we gotta do a lot of other work. Your face right now is not suitable for that, but we can make it suitable. Yes. So let's start with this. I have a few things here. You'll have to forgive me. I lost my ruler, so I'm going to be using this accurate size, actual size, printable 12-inch ruler. And we're going to use this graph to talk about your face. This is just a blank sheet canvas. Could be just gender neutral, no gender. This is just a person. We're going to be using that to define your face and figure out what we want to do. And then if we look at this, these are some nose shapes that maybe we can do. Sorry, the lighting's quite bright in here. I really got to see all the flaws, So your nose now is kind of like this, but a little more flat. Maybe we just need to bring it to a point and really accentuate it. But we'll see once I start touching your face if that's okay and doing like an up-close examination. Then I'll really get an idea for what's wrong. Okay? So, with that being said, let's just jump right into it. I have to make sure I have my gloves in my pocket here. Now, you're not allergic to latex, are you? Oh, you're not sure? Well, it's a good thing that I carry an EpiPen with me because I always use latex gloves. I don't care. My patient just starts going down, I'm just gonna stick them in the thigh, inject the EpiPen, and continue on with my latex gloves. So let's see if you are allergic or not. Hopefully not, right? Come on, thank you. Now, what I want to do, these gloves are absolutely terrible. Is it okay if I just go ahead and touch your face a bit? Okay. Have you ever broken your nose in the past? That you know of. A lot of people say they don't know. Well, I got hit in the nose. I got hit in the nose a while ago. And it did hurt and it was really swollen and crooked. But I just never got it looked at because no reason. Has that happened to you? Okay. Because right here, It does feel like there's quite a rigid bump, as if it was broken at one point. So, of course, this is going to be a bit difficult to do a nose revision because, can you see this? Right about here on both sides, you have super hard, just a lump. Like, it's just super hard and like, ugh, of course it's in the way. And we're gonna have to really like take the chisel and just boom, knock that out of there. And I'm not sure if we're gonna have enough cartilage tissue remaining to be able to fix your nose and get it nice and smooth. So we may end up taking a little bit of cartilage from your rib to go ahead and make that seamless. Is that something that you would be willing to do? Yeah, I feel like in your case, this operation will be life-changing for you, to say the least. And so I think we can go to any extreme measure possible. We just really want to change how you look right now. Actually, we're gonna probably change your face like a little bit so much that you might need therapy. You'll look in the mirror and be like, I do not recognize myself. And that could be good or bad. Some people like that. Some people can't take it. It's the truth. So anyway, we're gonna have to do something here because this is scar tissue. Okay, so that needs to be removed. Right? Alright. So once we remove that, what else do we need? Looking at you, I'm thinking, let me go ahead and just pull up on your eye right here. Pull up. Just pull that a little bit. I think you need an eye lift. Yeah, the corners of your eye is just like a little bit droopy, probably just aging, or like maybe you were just born with your eyelids turning down, but that's not nice for you. For you, we want to do something better. For you, the natural look, your pre-surgery, just bare-faced natural look is just, it's not gonna be good enough. And I know you don't feel good enough, right? Because you're not right now, and you want to be. Yeah. So, okay. We're gonna need to take this outside corner of your eyelids and pull them up. Up and out. Cat eye all the way. Outer corner up and out. And we use a very non-invasive surgery where we use a thread now and put that under the skin and attach it to the fibers and pull. Works really well. Works like a charm most of the time. So we'll do that. Let me make a note. Put this cap on the back of the pen. Eye lift. Eye lift. Okay, so we're going to change your nose. Actually, we didn't even talk about the tip of the nose. We're going to make that into a point. Because that's what's going to be most flattering for you. Now let's see about your eyebrows. What do you think about your eyebrows? I know it doesn't really matter what you think because you're not the expert. I'm the expert. But how do you feel about yourself with your brows? Probably not very good, huh? Yeah, but it's okay because we can make them better. We can make them much better. Let's see, what would be the best option? Turn to the side for me just a little bit. I know what we're gonna do. Your forehead bone, it just protrudes a little bit too much. So it's forcing your eyebrows forward. Okay, from the side, your brow bone kind of stands out, and I'm sure you probably don't like that. So what we're gonna do is go behind the tips of the brows with it's almost like a file, like a bone file, and we're just gonna smooth that down so that the bone is just not so boom prominent, we can do that for you. Then your side profile will be much nicer, much smoother, and just, well, more flattering for other people to look at. Yeah, that sounds like a good idea. Okay, so we'll do that. Now let's talk about your lip area. Your lips are, I don't really have any words because they're just average. There's not anything really to remark about. So I think what we should do is plump them up. Everyone looks good with just a little bit bigger lips, right? But when we plump yours up, let me show you if I have it on me. Oh, there's the lid. So don't mind this. I used this on the last patient, but I brought it in to show you just so you could see like what the process is about. So this is going to be our needle that's going to inject fillers and different types of things that probably aren't good to go in your skin, but they claim they are. Sorry, I just have to get my hair out of the way. And my gloves, I'm sure, are still clean, so just forget I did that. Anyway, so this is where the filler is going to go in, right? And how this looks is a cannula on the tip. We can put needles if we need to for more fine areas. For you, we probably will do a needle, because what's going to happen is we'll put the needle in the top, and the needle will help control the amount of filler that we use. And when I'm looking at your lips here, I think we really need to just go ahead and puff them up in certain areas. Right here on the Cupid's bow, we're just gonna expand that, make it bigger. Down here on the bottom, right in the middle, expand that. So that when you look from the side, you have really nice, just like fish lips. Because right now from the side, go ahead and turn and do this. Don't do that, never mind. We need to do this for you. So this cannula would be better if we're injecting like the cheekbones or another area. But since we're going to be adding volume to your Cupid's bow in the middle of your lower lip, we want to go ahead and use a needle. That way it's super dispersed. Boop. Like we know where we're putting it. Super accurate is the word I was looking for. Not dispersed, super accurate. Just shove that in there. And so let's see, let me write that down. I'm gonna go ahead and measure. Like I said, this is my little ruler. And I want to measure your lips. Your mouth from corner to corner is about 1.75 inches. We might need to attach a string to the outside corner of your lips and pull them as well. You need a little bit of a longer look to your mouth from corner to corner. Let me make note of that. Make longer for sure. So we'll make that longer, we'll stretch it. Okay, we're gonna add the volume right here to the center. The volume is going to the center. Volume, 2 exclamation points so I can let myself know, like, really, volume. All right. Let's talk about your cheekbones and your jawline. So just toss this hair back. Smile. Let me measure. You can stop smiling. We're going to add some volume into your cheekbones. We want to really make you like, pow. So, I'm going to inject upwards since we're doing an eye lift and we're going to shave some of that brow bone down. What I really want to do is lift your cheekbones. Right now, they're like, kind of like falling down, like gravity is just taking them down. But we don't want that. We want them to be fruitful and lifeful and full of just young youth look. So we will inject upwards. Now for this, there goes the cap again. This, we'll be able to use the cannula, and we're gonna, a lot of times they'll fill and just boop, boop, boop across, or people will inject right here into the middle of the cheek. This is not the spot that you are to inject because gravity pulls all that down and forward, and as we age, that's just gonna come to the center and it's gonna look no good. So we're going to inject upwards. Sorry, don't mind this. I know that it is contaminated and just dirty, but I won't touch it to your skin. Put that ruler down. So what we're gonna do is, let me show you all the spots so far that we know of that we will be injecting. We're going to inject on the cheekbone. I was gonna say the brow bone, but the brow bone we're shaving down. So we're going to inject on the cheekbone, and we're going to go in an upward motion, boop, 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 upwards and backwards. Then we're going to inject in the Cupid's bow. This area is going to be injected with the cannula that looks like this, and this area will be injected with the needle for better placement. And yes, it will be a clean one, not this one. So anyway, we'll inject there. Your nose, I'm not 100% sure. We are going to revise the tip, and if we revise it a little bit too much, which happens like quite a bit, and I look at it after I take a little bit too much off and I'm like, dang, what did I do? Well, gotta fix this now, so I'll just go ahead and inject it with filler. Patients never know, so if that does happen to you, don't worry. I can just do a quick fix, doot. You would never know. So then, mention the lips, sure, maybe the nose might have to be injected. The forehead is good, we don't have to inject that, but let's go ahead and talk about what we should do down here on your jawbone, your non-existent jawbone right now. This is what I'm thinking. Turn to this side. Let me feel back here towards your ear and see if you have any definition at all. And lift up a little bit. Feel your chin here. Does that hurt? You got a lot of extra adipose tissue down here, which is fat tissue, so we need to suction that out. Is that okay? I mean, we really want to give you, we want you to go from the 2, 3 that you are now to a 12 plus. Past 10, you're gonna be a 12, okay? So, see how this person here, this figurine, has a very defined jawbone on each side and then kind of a flat chin. This is your chin pretty much. It is kind of flat and not very defined, but your jawbone is more like this, super round, okay? Round jawbone, and you just got no chin. And this is a lot of fatty tissue down here, which is fine. Everybody can have that, but that's why you're here, so we can remove that on you and make you better. So, what I want to do is remove this lipo under there, and that will start to give you a nice shape what we'll then do is inject some filler right here into the corners so that it gives the illusion. The illusion, it's all about what the eyes see. Give the illusion of a much more attractive appeal. And then for the chin, once we do the lipo, I'm not sure if the chin shape will get a little bit better. Let me go ahead and feel your bone structure here and see if there is any roundness or if it is just kind of squared off for some reason. Excuse me. Feels kind of straight. So what we'll do is, since we're already going to use the shaving tool to refine your forehead bone, we're going to use that same tool on your chin in a boat or canoe scoop method. File, and we're going to shape that to a more round and appealing shape. Because right now there's no shape. There's no shape. There's no shape anywhere on your face. That's what we're trying to give you. So, let me make a list of everything that we are doing here. Forehead, eye lift, forehead, eye lift, nose refine, lips, cheeks, jaw, chin. Did I miss anything? Okay, and yes, lips / mouth, because we do want to change the outer corner. I think that should be pretty good. Now what I want to do is take just some measurements. I didn't even know I was still holding this. Let me take some measurements on my hopefully accurate tape measure here, because in the event that this isn't accurate because I printed it, and funny story, I accidentally printed it on sticker paper, so this is just stickers that come off and then we wouldn't even be able to read the ruler, but that's okay, it'll serve the purpose. I want to go ahead and just take a few measurements. Your chin now is okay. Very asymmetrical right now. Interesting. And let me see your nose. Okay. So, with that being said, when would you like to schedule this procedure? Yes, procedure as in singular. Oh no. No, we don't have to do this in multiple sessions. Where? Where did you see that? On my Google reviews? Who? Do you remember the name of the patient? Maybe it was a fake patient. They might not have even got the work done by me. Merriam-Webster. Doesn't ring a bell, no. I know the names of all my patients. I sign off on all those paperwork before they go under the knife. I know the names. Never had a Merriam-Webster. No, sorry. Anyways, so here's the thing. To address your concern about doing this all-in-one surgery, I've done much more extensive work. I'm talking face, chest, back, legs, buttocks, everything in one sitting. And I've done maybe, I would say, 300 of those surgeries. And I've only ever had about 25 deaths, not very many. So, you know, I highly don't think that there's anything to worry about, I can tell you that. But here's the kind of iffy part. Couple things. You're going to have a whole new look, and because we are going to be doing damage to a lot of your body, meaning we're going to be using files to sculpt and cut and liposuction to jab, what's going to happen is there's going to be immense bruising and swelling. So your face, for everything that we'll be doing, your face is going to be completely wrapped up and bandaged, and you'll probably, there's a chance that you might not even be able to open your eyes for a few days, because they might just be swollen shut. Yeah, so we will do what we can though to minimize swelling. We can lay just a ton of ice packs on your face. We can do what we can do, give you medicine, anti-inflammatories, but it's only going to do so much. The body has to take the process of healing and getting better, and then the swelling will go down. Sometimes it takes even a month. So that's the first part of it. The second part of it is, in the event that you can see and you can open your eyes and such, what you might see can be very mortifying. It can be very, very mortifying because it's quite different, and like, you look like a monster. Most people do, but once the swelling goes down, hopefully, fingers crossed, because you just never know, but hopefully you look much better than you did before. Number one, before the surgery. Number two, before you swelled up. So it can take time, and in the event that something like just goes wrong, and say your nose is just obliterated and it's not right, well, then we always have this. We can just add some filler, maybe some type of silicone filler, like something to make it look more natural if it's messed up. But that's only happened maybe, like, I can count on two hands how many times something like that has happened, so not too bad. But yeah, I just feel like you really want to do all of this in one procedure, because it's expensive to staff the operating room and to pay for it to be all cleaned and sanitized. There's a protocol we have to do. Plus, if we use an anesthesiologist more than once, it just gets expensive. And I think you just want to do it all in one. There's a minimal risk of you passing away. Yes. So, when do you want to schedule this? Are you going to go ahead and go through with it? Like, are we going to do this? You want to think about it now? Okay, so let me ask you this. When you came into the office today, you seemed very sure that you wanted to change, and now you seem frightened or taken back. Is there a reason why you seem not so sure about the surgery now? Okay, well, that's fine. We will let you think about it, of course. You can call our office if you want to book it. We'll have all your information saved, and then just give us a call and say, this is so and so. I was there for my consult and I want to book the surgery, and we'll get you rolling. But don't wait too long, especially if you want it done by the time 2021 ends. We're coming up on a new year. You can really take the slogan, New Year, New Me, to a whole new level. You need it. You need it. And you'll feel great going into 2022 if all goes well with the surgery. But yeah, most people want to come in and they want to get their new look by the time the year ends. So don't wait too long. If you are thinking of booking, time's a ticking, we're going to get filled up with the OR, so don't take too long. Okay, so I have other patients that I have to go see now, other people who need to be fixed, and yes, so it was just absolutely astounding and lovely meeting you. I hope that I can see you on that OR table so that I can really do you some favors, and you have a wonderful rest of your day, okay? Alright, take care.